Pro-choice activists are always getting their knickers in a twist about what they call fake clinics. Those pro-life pregnancy resource centers where they do things like provide free ultrasounds and hand out baby clothes and give financial counseling and help homeless women find housing and hook abused women up with battered women's services and things like that. All that horrible stuff that just endangers women all day long. But they just can't seem to care about a fake clinic that actually kills a woman. This is Christina with the Sisyphean Journal, and today is February 3rd. I don't know how often I'm going to have to go off about this, and this is one of the things that I'm trying to get through to average pro-choice citizens, and that's that the abortion lobby is there to serve the interests of people who make a living from abortion. They are not there to help the women. The women who show up at the rally and the boyfriends and everybody else, and you're holding those keep abortion safe and legal signs, and you're voting for pro-choice candidates, and you're doing all that other stuff. The interests you're protecting are the interests of people like Dr. Romeo Ferrer that I'm going to talk about today. You are not protecting women like Denise. Now, Dr. Ferrer's Gynecare Center looked like a clinic, right? A patient making an appointment would assume that this is a licensed clinic, that the state comes in and inspects it and oversees it and makes sure that it meets all the proper safety requirements for an outpatient surgical center, right? You would assume that. Why somebody would assume that a place that just does ultrasounds and hands out baby clothes is passing itself off as a clinic, I don't know. And their ultrasonographers are actually trained, unlike a lot of the ones at abortion clinics. Gynecare's website described the facility as a modern, clean clinic designed to provide quality health care for women and girls of all ages in the Maryland area. Again, it was a private doctor's office. It was not a clinic. It was falsely advertising itself as a clinic, and the abortion rights lobby totally does not care. Pigs will fly and hell will freeze over, and Rush Limbaugh will vote straight Democrat before the abortion rights movement is going to care about places like this, because they don't care about the women. It's nice. It's a good bonus if things work out nice for the women. It's kind of like if you go shopping for a car, you have all these features that you're going to want, but the color of the car is not going to be number one on your list. You're going to go for the car that meets all your other requirements, that if it happens to be available in a color you like, that's great, but that's the icing on the cake. That's not the cake. And that's what abortion safety is. It's a fine option if you happen to have it available, but it's not the number one priority of the abortion lobby. It never was. Red pill on that. Denise was 21 when she dropped her 3-year-old son off at a babysitter and drove off to Ferrer's clinic-looking office for an abortion on February 3rd, 2006. She had $800 to pay for the procedure, and she was 16 weeks pregnant. She just thought she'd have it done and nobody would know, her mother later told the Baltimore Sun. So Ferrer started the D&E abortion at around 1 p.m. That's when they used the forceps to go in and pull out the baby in chunks. He used ultrasound guidance to help visualize the baby as he took it apart. 25 minutes later, he was still pulling fetal parts out of Denise, and he administered 20 units of Pitocin via IV. 5 minutes later, he added 125 milligrams of Demerol and 5 milligrams of Versed, which is a short-acting anesthetic that also induces amnesia. Because, as he noted in her medical chart, Patient was still reacting to pain. He administered additional doses of these drugs. And it wasn't until 1:45 that he completed the abortion. So typically these abortions take 15 to 20, maybe 25 minutes. This one took 45 minutes. So Denise was moved into the recovery room, and 2 minutes later, a surgical assistant noticed that she was turning blue around the fingernails. The nurse assistant was unable to get a blood pressure reading or a pulse and told Ferrer. He gave a verbal order for Narcan, which was administered by the nurse assistant. So the Narcan, of course, most of you are familiar with, that is to counteract the narcotics. So at 1:50, that's 3 minutes after they noticed that Denise was turning blue and wasn't breathing and had no pulse, he finally started resuscitation efforts, which is about 3 minutes too late. He did perform CPR and have an assistant perform CPR while he administered epinephrine. Staff called 911 while Ferrer continued his resuscitation efforts, and the very first thing they should have done when they noticed that she was blue and pulseless and not breathing was call 911. They should have done that 3 minutes before he started CPR, not slogged along for a while and, oh, this isn't working. So, another thing that, and this is common in abortion facilities, they are supposed to be able to perform professional level CPR, which means you intubate the patient so that you can be sure that the air is going directly into the lungs, you're not inflating the stomach. Nope, wasn't intubating her, didn't even put in an airway, which is one of those little plastic guiding things that an EMT can put in that helps to keep the airway open. Didn't even do that, just the head tilt chin lift, like an ordinary bystander would use to do CPR. So the medics arrived to find Denise still unresponsive and, of course, pulseless. They used an oxygen mask and administered additional drugs as they transported Denise to the hospital. And emergency room staff continued their efforts to resuscitate her, but she was pronounced dead shortly before 3 p.m. The autopsy found no underlying medical condition that would have made Denise's heart stop. The cause of death was given as an overdose of Demerol. The National Abortion Federation defended Ferrer. Their spokeswoman, Melissa Fowler, told the Annapolis Capital that abortion is safe due to the specialized quality of care provided by clinics like Gynecare Center, which would indicate that Gynecare was a National Abortion Federation member. So here we have a place, pretends to be a clinic, doesn't follow the procedures and safety things that a clinic would follow. Young woman ends up overdosed on Demerol and dead as a coffin nail. And the abortion lobby comes forth to defend the people who killed her. But if she had gone to a pro-life center and they'd given her baby clothes, we'd have had screaming, bloody murder about how those horrible fake clinics endanger women. You tell me what their real priorities are.